It was about 10 o'clock in the morning or so. Standard day, get up, get in the truck, go to work. I was inside of the pruning tower. As I was going up, I realized I was getting closer to the ceiling and that I let my foot off the up switch and it wasn't stopping. So I kind of thought to myself, what am I going to do now? My accident was on April 11th, 2014, and I was going to be installing some exterior lights on a building very similar to the one we're in right now, just a kind of a metal shop. I was inside of the pruning tower, which is not the most designed for working out of. They're designed to prune trees out of is what they're designed for. And I was going forward and up at the same time, headed to my destination. I was working on a box on the wall. And so as I was going up, I realized I was getting closer to the ceiling and that I let my foot off the up switch and it wasn't stopping. It kept going up and my hand was on the joystick to try and stop me from going forward. So as I was letting my hand off, the left arm got pinched against the ceiling. The paramedics got there and kind of assessed the situation and said, all right, let's go. So got me on the gurney and got me in the ambulance and headed out to Doctors Medical Center in Modesto. Dr. Tresiak came in and kind of gave me the rundown of what was going on, and I had severed my radial nerve as well as some muscle around my elbow. I couldn't open my hand, so I couldn't extend my fingers. My hand wouldn't do anything at this time, but most of it was related to shock. I did a lot of research on Tresiak and found out we have some common interests. He's a car guy as well, which I thought that was cool. Tresiak had no reservation as to whether or not he could have performed this surgery, none at all. And so that attitude is what kept me at Doctors Medical Center. A couple months after the injury, it wasn't quite doing what he thought it was going to do at that point, but he said, let's not freak out yet. Let's just exhaust the biology of this injury until there's no possible way that this is going to work or whatever like that. But about 2 or 3 weeks after that, I was laying in bed and my hand kind of had like a surge, you know, it felt like a little bit of electricity in your hand. And I said, oh my, that's pretty interesting there. And so I kind of got a little excited. And then over the next 2 weeks, it started coming back slowly and slowly, and I was able to open my hand again. And now this has been coming up on a year now, or about 10 months, I think. And my hand's back in action. The thumbs up is about my last thing I'm looking to do. I like doing that, but the right hand works too. If I had not had the surgery at Doctors Medical Center, I think my life would be quite different right now. If somebody were to ask me if they should go out of the area or not for a certain operation, specifically hand and the upper extremities, I guess you would call them, there would be no reason that I would say to go out of the area. We have the local hospital here that does a great job. Like I said, their entire staff was nothing but wonderful when we were there. It's been a great experience. I'm just thankful that it's all worked out. Yeah, that's the joke, because it's not all the way up yet, but it'll get there. I got another year, so we'll get there.